Once he's done with that, I'll call upon Dr. Jeans to elaborate on a few or fill in some gaps if there are any, after which then we can field some questions in respect of the issues discussed. Thank you. Over to you, Dr. Msi.
Thank you, Honorable Minister. We want to talk about the health issues associated with the Olympics in Brazil, and there are quite a number. To begin with, we need our athletes to have gone through their proper vaccinations, and routine vaccinations for diphtheria, pertussis, tetanus and polio, measles and mumps should be done before they travel to Rio. They can also take vaccines for influenza and vaccines for hepatitis A, because it is also prevalent in Brazil. If they are traveling outside Brazil, outside Rio, they should also prevent typhoid fever and rabies and yellow fever, because these are also transmitted by the same mosquitoes which are prevalent in Brazil. However, of concern, I think all of you would want to talk about Zika, which is of concern, and it is a recent phenomenon. We want to let people know that Zika virus is caused by an Aedes mosquito. It is slightly different from the mosquito that causes malaria, which is the Anopheles mosquito. And because Zika causes just a mild fever or a skin rash, that may last for only 2 and 7 days, it has got other important health repercussions. That's why we want our people to then take precautions for prevention of transmission of Zika. Well, some of you may already know, these repercussions include microcephaly, which is those that are pregnant could come out with a small head. So we want to prevent this. The distribution of the mosquito, the Indian mosquito, particularly in Brazil, where the games are taking place, is low now because being winter, the amount of mosquitoes, they are much less. And in Brazil, they have taken measures now to spray for mosquitoes, which is the vector, and we want our athletes to cover themselves, wear protective clothing that normally cover themselves. They also must use mosquito repellents while they are in Brazil to stop the mosquitoes from biting them. We want them to drink certified safe water, as the water situation there is not particularly specified. So we want them to drink certified water. We want to tell our athletes, pregnant women should not be advised to travel to Brazil or areas that have got Zika outbreaks. And for the females that have traveled to Brazil, they must avoid pregnancy for 8 weeks after returning from Brazil. And for the men, to use protection for 21 days after they return from Brazil. When the athletes will return home, as Minister of Health, we will organize surveillance for a period of 21 days for all the members that have traveled. What we will be checking is if they develop a fever, a skin rash, or muscle or joint pain. If this happens, the Ministry of Health is at their disposal. We are able to isolate the Zika virus in their blood and advise accordingly. And we also want to advise that all who have traveled to Rio but have no symptoms must use condoms for 8 weeks to protect their sexual partners, because it can also be sexually transmitted. So men who have Zika symptoms or are diagnosed with Zika should use condoms for 6 months. If the man's partner is pregnant, the couple should either use condoms or should not have sex during pregnancy. And women who have traveled to Rio but do not have symptoms should wait 8 weeks after travel before trying to get pregnant. That is basically what we have, and I think we have prepared for you a bulletin which the minister is going to give you which is more comprehensive and will provide protection for our athletes. I want to assure you that it is safe to travel to Rio, because once we take these precautions, we should be able to have successful games with good health outcomes.
Thank you, Minister. Thank you so much for that very important intervention. I think that colleagues from the media would want to know in specific terms what we have done to, as Team Zimbabwe, to prepare our athletes for any eventuality predicated around issues of health and their well-being whilst in Rio. We have taken steps as Team Zimbabwe, the very important steps that we've taken to try to assist our athletes that to the best extent possible whilst in Rio they do not contract the Zika virus. And I would like at this juncture to invite Dr. Austin Jeans, to speak to the specific measures that have been taken to protect our athletes from contracting any form of disease whilst they are in Rio, or to reduce the exposure to disease. Thank you. Over to you, Dr. Jeans.
Thank you very much, Honourable Minister. Our role as the medical team that is supporting Team Zimbabwe to Rio 2016 is definitively to ensure that our travelling Olympic team is protected to the best of our ability and knowledge from, in the one instance, infectious disease to which the Deputy Minister was referring. In this regard, we have ensured that the team has been vaccinated against those diseases which the Deputy Minister outlined, which are preventable by vaccination, and therefore this team has been vaccinated against influenza, hepatitis A and yellow fever, which covers the large base of health concerns with respect to travel to Rio. The Zika virus situation, as you have been made aware of, is not a disease condition that currently has a vaccine prevention program. The vaccines are still to be designed and devised by the World Health Authorities, and therefore we are guided in our advice, in our implementation of a prevention program by those guidelines that are laid down currently by the World Health Organization, which have been adopted by the International Olympic Committee for these games, and by the very valuable advice that our own Ministry of Health and Child Welfare have also put down, which are consistent with all of those guidelines. So what we have been working on in the last couple of weeks as Team Zimbabwe has been finalizing and preparing is that we have devised a bulletin on Zika prevention for the team when we travel to Rio, which incorporates all the aspects that have been outlined. Most notably, we are making sure the team is fully aware of the Zika situation and its relevance to them personally, as individuals and as athletes, and also from the public health perspective that we have as Zimbabweans returning to Zimbabwe. So awareness is very important, and the team have all received one bulletin in this particular respect and are about to receive an updated bulletin this week prior to the initial parts of the team contingent departing for Rio. We will obviously in Rio be reinforcing the information situation so that we ensure that all the team are fully in the loop as far as the information that they need to have. We have made them aware that the most effective way to not contract the Zika virus is to prevent being bitten by the relevant mosquitoes that they have there in Rio and which we do not have too many of here in this country. There are a number of relevant environmental issues that significantly reduce the risk of Zika transmission to Zimbabwe and the risk to Zimbabwe. One of them are the environmental conditions in Rio when we are there. It is winter in Rio, to which the Deputy Minister alluded. Therefore, mosquito activity in winter months is very low. The Rio organising authorities and their public health bodies have been extremely active and are building it up more and more as we approach the games in mosquito prevention measures, which means spraying of all the areas in and around venues and the Olympic Village and removing water sources of mosquito breeding. So I think that program has been in place for the last couple of years and will be very effective in reducing the risk to athletes when they are there. So if they're not exposed to too many mosquitoes, they're unlikely to contract the disease. We are also supplying them with a pack, which the CEO has come up with for our team. This is what we call our Zika or anti-Zika pack, which contains the relevant mosquito repellents that our team will be using inside. And also we have some protective condoms for, hopefully, not for use by the team. Because obviously, in the advice with respect to sexual transmission, we are going to advise our team, and especially those who would be at a higher personal risk, i.e. the women in our team of reproductive age, the younger men in our team. We are going to advise them very strongly to avoid any sexual contact in and around the games whatsoever, because that's an absolute way of preventing sexual transmission. And if they should decide to engage in that activity, we will at least provide them with the protective measures, and we know that at the games these are also freely available. Back to mosquito transmission, we are ensuring our team are aware of wearing appropriate clothing, long sleeves, long trousers, closed shoes, socks, and the use of the repellents all day. In deference to our malaria mosquito that bites here in Zimbabwe, it's a night-feeding mosquito, so our risk of malaria contraction is nocturnal. But the Aedes aegypti mosquito feeds during the day and possibly at night as well. So we're telling our athletes you've got to use these repellents day and night on the exposed areas of skin. So they're going to be fully aware, and they're going to have the tools with which to prevent mosquito transmission of this disease. So I believe that given the environmental context of reduced mosquito populations, given the fact that we are providing our athletes with both the information and the tools to prevent mosquito and sexual transmission, we are really doing as much as can be done to effectively reduce the risk of Zika returning to Zimbabwe. The Minister has alluded to the fact that there will be a program of screening of athletes when they return. Should they develop any symptoms, they will be alerting the responsible authorities. We have the laboratory tests to detect the virus, and they will be monitored should that happen, plus all the other measures that we'll be telling the team to take when they return to Zimbabwe. The other point that I think is important is that although the duration of travel to and travel back from the games is approximately a month, there are very few of the Zimbabwean contingent that in fact will be away in Brazil for the full duration of that time. Athletes are coming in on a staggered arrival schedule, and they're departing on a staggered departure schedule when their events are over. So in terms of exposure time to the Brazilian environment, it is quite short for many of the athletes and officials that are traveling to Brazil, which is another effective way of reducing the risk. And perhaps just finally, I will make you aware that the US Center for Disease Control, which is a World Health Advisory and Research body, published a report on the 13th of July, which only puts 4 countries at risk of Zika transmission back to their countries, and we're not one of those. And those countries are Chad, Djibouti, Eritrea, and Yemen. And the assimilation of that conclusion is based on a number of factors. So even from a risk research assessment, we are not in that risk situation. And a lot of that has to do with the environment, the type of mosquitoes, the fact that our athletes will be returning to Zimbabwe, also still in a winter situation. And also many of our athletes are not returning to Zimbabwe. Many of our athletes and officials are returning to the home and training bases, which are UK and US based. So from a Zimbabwe team situation, we're pretty confident that we have this under control, and should we be successful in both the awareness and the implementation of these measures, I don't believe that the risk is significant at all.
Good. Thank you, Doc. I appreciate that very elaborate presentation that you have made in respect of the measures put in place to deal with any eventuality relating to health as far as the team staying in Brazil is concerned during the summer games. Obviously, I think from the presentation by both the Deputy Minister and the doctor, it's clear that Zika is not the only potential problem that athletes would encounter. Zika is just one of several other potential problems that athletes would encounter. But to deal with that, to mitigate against any dangerous effects, steps have been taken to intervene in that regard. And therefore, at this juncture, I want to ask that we ask questions if we have any questions on issues that we think need to be clarified. I want to request that we confine ourselves to the subject at hand, which is the traveling party and the potential exposure to the risk of disease contraction in Brazil. And then so that we address that specific matter as has been the case in our primary submissions. Thank you very much. Yes. No questions. Oh. Yes, ZFM. Yes.
How assured are you by the report